This training video has been put together by the Critical Care Psychology team alongside the unit Patient Diary Champions. It will cover how to complete an ICU diary. Patient diaries have been widely used in critical care units in the UK, Europe and America since they were first introduced in 2001. They are a nurse-led intervention designed to reduce psychological trauma and to improve individuals' quality of life after critical illness and mechanical ventilation. Patients often describe having very little or having vague memories of their time in critical care. They will also often describe not being able to distinguish between what was reality and what they dreamed about, which can cause distress. Patient diaries form a daily account of a patient's admission, written in everyday language that includes aspects of their care, medical updates, key milestones, and a description of situations and surroundings in which the patient might find recognition in. It helps to start to fill in the memory gaps, blanks, and to help individuals understand their critical care illness. Critical care staff should take the lead on completing the diary, as this process may initially be too overwhelming for the relatives and because of restricted visiting on the unit. All members of staff are invited and are welcome to make entries. A diary with contributions from nurses, doctors, physiotherapists, speech and language therapists, dietitians, healthcare assistants, rehabilitation assistants, chaplains, and the patient's relatives and friends is likely to hold more meaning than a diary filled in by one person alone. It is important to remember that the diary could be read by relatives or others without the patient's consent, so it's important not to include highly sensitive information. Over time, relatives should be encouraged to write in the diary on a regular basis and be offered greater involvement in the diary. Some relatives may prefer to keep their own diary. This is absolutely fine. The main thing is that we all work together to record useful information until the patient is well enough to do this for themselves if they wish to. New diaries are accessible from the following location, so the B3 photocopier room. Diaries should be considered for all adult patients who have been admitted into critical care for 7 days or more, especially those patients who are mechanically ventilated. Patients who are under 18 years of age and those admitted following a deliberate suicide attempt should not have diaries routinely started for them. These inclusion and exclusion criteria should be considered as guidelines, and if you are not sure if a diary should be started, then you should contact the critical care psychology team. When a new diary is started, turn to page 3 and make sure that all the details are completed, so the patient's nominated representative and the key person within the medical team that they are liaising with. After completing pages 4 and 5 of the patient's nominated representative, page 6 looks at details about the patient. So this information really helps us to be able to connect with that person and to be able to hold on to and find out about who they are. Again, the relatives might be really helpful in answering some of these questions, but thinking about, what name the patient would like to be known by, what is their language, are they bilingual and prefer to communicate in one language over the other, would they need an interpreter or a translator when they are starting to communicate. Again, thinking about making that person as comfortable as possible. Are they somebody that might need a hearing aid or their glasses? And who's in their family? What are their hobbies and interests? And again, this helps us be able to connect with that person on that human level. So this part of the diary looks to summarise the first 7 days, the first week of somebody's admission into the unit. So it starts with the date that somebody was admitted and the bed the bed space that they were at. It might be helpful to include how that person came into hospital and sort of a summary of the procedures that they had, whether they were taken down for a scan, whether they had a scan at the bedside, and the overall plan for their treatment in layman's terms. It can also be useful for family members if they are feeling up to it to write something in this section underneath about what was going on at home, perhaps thinking about kind of the news this week as well. So are there any sort of big headlines that might be helpful to include in that, to start to give a sense of that timeline. The following sections of the diary are set up like this, so just with an open-ended space for individuals to be able to write down what they would like to in the diary. So making sure that all the entries are started with a date in order to kind of keep that sense of a timeline running throughout the diary. In terms of what might be helpful to write in this part of the diary, we can ask ourselves a key question, and that is, what would a patient want to know when they're trying to make sense of any disturbing memories that are continuing to trouble them following their critical admission? So things that might be helpful to help answer that question would be about their critical illness, its treatment, including what you did when you looked after them, and any other significant events. It could be helpful to have some information from the relative's perspective. Might be helpful to have information about events from the outside world as well, such as sports results, the news, anything that can help somebody reconnect with their life. It can also be useful to include how the patient's condition has changed. So if they've had any recent procedures or what that involved, or if there were any worrying incidents, perhaps you could write a reflection. So maybe you looked after this patient a few days ago and now you're looking after them again, and you've noticed changes in the way that they are and the improvements that they're making. It can also be helpful to include details about the environment, such as any sounds they might be able to hear, like the beeps from the machines on the ward, any smells or changes in temperature, changes they might be experiencing. So if anything is going on in the ward environment, for example, if the therapy dog has visited them, or there's some maintenance work going on in the corridor, so there might be potential to hear some banging noises. When you write your entry, it's important to include the date and time, as this can help the patients form that coherent timeline of their experiences when they're reading it themselves. When you're writing in the diary, a sensible approach is to write only what you would be comfortable to disclose verbally to a patient or their relative at the bedside. So try and relate what you write to how you would normally verbalise that information. Avoid using medical terminology, jargon, and abbreviations, and write in everyday or layman's terms. So avoid any sensitive or personal information, including any details of test results. It's not necessary to make an entry every shift. However, entries should be made when there is a significant event or milestone to write about. So, for example, you could include when somebody is extubated, when somebody has a tracheostomy procedure, when they are starting to sit on the edge of the bed for the first time, or when they've taken their first stand. The writing style should always be professional and relevant. As much care and consideration should be taken with a diary entry as any other form of professional documentation. So remember to use black pen and write clearly. This slide here is just really helpful to think about what types of entries can be really helpful, and perhaps the types of entries that we should try to avoid. So on the left-hand side, this shows sort of really helpful examples. So for example, writing, "Hi, my name is, and I'm looking after you today." You could write about somebody is having a family visit. So for example, your wife and daughter have been at your bedside most of the afternoon. They were discussing the football results with you. This weekend is the FA Cup final. Or you might want to convey some medical information. So for example, your blood pressure dropped today. We started you on some medication to try and help raise it. And on the right-hand side of this slide, we can see that there's quite detailed medical information here, and that's what we're trying to avoid. So trying to use medical jargon such as CPAP, or talking about different drug usage, drugs that have been used. So just, a brief recap really, and perhaps covering some of the information that has been already presented earlier on in the presentation, but just thinking about a really kind of holistic overview of what would be helpful in that ICU diary, and thinking about what patient might want to know to help them understand their delirium experience, or to understand the journey that they've been on when they're reading this diary. So, some really key things would be about sound, smell, the senses, the temperature the patient might be experiencing at that time, how the patient's condition has changed, perhaps any procedures that they've had done. I think it's also really helpful to include when the patient has been taken off the unit. Perhaps that's to go for a specific scan or procedure, or whether they've changed bed space area, and if there is a reason for that, it might be helpful to include that, and any other sort of significant events that might have happened. So that could be about when relatives or friends come into the unit. It could be more topical in terms of what's going on in the world. So, for example, it might be that we've just had a new Prime Minister, or it could be that there's a certain sporting event on, or we're coming up to the Christmas or religious festivals and celebrations. Relatives should be supported to contribute to the diary as soon as they feel able. It might be helpful to reassure families that there is very little they can write that would make things worse for the patient. We encourage families to express themselves freely in the diary, since patients usually prefer to know about things that have happened, even if they are upsetting to think about. Relatives or visitors might like to write about family events that the patient has missed, birthdays that have happened, their thoughts and feelings, messages from friends that they haven't been able to visit in person. They might also want to include messages and drawings from children, or to talk about news from the wider world that the patient would be interested in, for example, news or sports scores. Remind relatives that the diary must not be taken off the unit, but if they wish to write an entry at home, then they can do this on a blank piece of paper or continuation sheets, and these can be inserted into the diary at a later date. Images, when incorporated into the diary, can be an extremely effective way of helping patients to understand what has happened to them whilst in critical care. Initial photograph when a patient is sedated and ventilated is recommended. Subsequent photos can be taken to show stages of recovery, the layout of the bed space, and the critical care unit. A photograph can be taken at the time when it may help patients understand what's happened to them. Photographs should be taken from angles which optimize patient dignity. Photos should not include other patients who are on the unit at the same time. A photograph may be taken without patient's consent when in the best interest of the patient. The potential benefit to the patient permits the taking of a photograph of a critically ill patient at a time when they are not able to provide consent. However, patient consent should be obtained before a photograph is taken wherever possible. So, for example, photographs which show recovery. A photograph must not be taken when consent has been withheld. A relative, friend, or staff member may be photographed with a patient if the individual concerned has consented verbally to this. So, in regards to taking photographs, photographs should be taken by a member of the ICU team using the unit tablet. This image should then be printed, placed in the patient diary folder with an addressograph placed on the back. No photographs should be left on the tablet or saved electronically. A photograph must not be used without a patient's agreement, so photographs must not be entered into a diary until the patient has seen the photograph and given consent. This part of the process occurs during a follow-up clinic. Photographs must not be given to family or friends. No photographs should be photocopied and placed in the medical notes alongside the photocopied diary prior to the diary being handed back to the patient. It is up to the patient whether they want to see the photograph and whether they want to keep the photograph. The photograph will be stored in a locked cabinet for 12 months in case the patient changes their mind. After this time, printed photos will be destroyed via shredding. If the patient dies, photographs are shredded and not returned to the nominated representative. There's some overarching principles of the diaries, and just to summarise, the diary is the property of the patient and is not part of the patient's medical record. We should assume that the diary will be read by relatives and others without the patient's consent. It must therefore not contain highly sensitive information. Our job is to facilitate the recording of information and safeguarding this information until the patient is well enough to make decisions about its future. A diary team of staff members from the ICU will take overall responsibility for the diaries and will give advice and support, and where necessary will make decisions about what is in the patient's best interest. These principles are expanded upon in the diary's SOP. So for safe storage of the diaries, whilst the patient is on the unit, the patient diaries will be kept at the patient's bedside in a plastic wallet. When the patient is discharged, the diary will be stored in a locked cabinet on B3 until the patient is well enough to receive it. A diary register will be kept to record who has a diary being kept for them, where it currently is stored, and when it is handed over to the patient. The diary cannot be transferred to any other ward unless it is already in the care of the patient, as they have been well enough to receive it. In terms of handing over the diaries to the patient diaries can only be given to the patient by a member of the follow-up team. If a patient dies, the diary will be offered to the designated representative. However, pictures will be removed. The diary will be stored for 24 months so the patient could collect at a later date than the follow-up clinic if they're not ready to receive it at that point in time. After this period of time, if the patient no longer wants the diary, then it will be shredded.